Just on the vaccination rate dropping, do we know why? Is it because there are fewer people coming forward for first doses? Can we prioritise bringing forward second doses for those who have gone 6 to 8 weeks? And also, are there appointments available? Do we know that there are appointments available that people can book in now?
So the issue is a couple of issues. One of the issues is supply. So there's obviously supply is a little bit lumpy in September. We're grateful for the extra doses we've been given, but there's a little bit of a lumpiness in supply, especially for younger people. So that's one challenge. The other challenge is because we had such a big push for first dose, obviously people have to wait a few weeks for their second dose. So there's those issues as well. But there is ample supply at Kudos Bank Arena today if people want to go and get the AstraZeneca. So there's ample supply of vaccine. I've had the AstraZeneca and I encourage people to get vaccinated. We still see people over 70 years of age or over 50 years of age who aren't vaccinated. There's no reason why anybody shouldn't come forward and get vaccinated. So we just want to make sure that people come forward as quickly as possible. We've seen in other places around the world things start slowing down between 70 and 80%. We don't want to see that here. We want to make sure that we get as many people covered as possible. And, I hold the ambition Dr Chant holds. I'd love to see our first doses get close to 90%. That's our dream, because then we know we're all safer, we're all more covered, and it means we can protect our health staff. I think every day about our health staff, because the more people that need to be hospitalised, the more people that are presenting obviously is a risk to our staff and our system. And the higher we get of that first dose, the quicker we get to 85 or 90% would bring us great joy, and I feel confident we can get there. Who hasn't asked a question?
On booster doses. Just on booster doses, there's evidence that after 6 months there's a lag in protection from Pfizer, not the AstraZeneca, that is a longer lasting protection, but with the Pfizer, a lot of our healthcare workers would have got Pfizer about in February or March first up. Are we planning to start rolling out booster shots now at that 6 month mark?
Yeah, I certainly raised this issue at National Cabinet, and I was provided information that Australia, the federal government, has secured boosters in a sufficient supply. And obviously, once we get over vaccinating our population the first time round, we'll have something to say about that. But it is an issue that I raised at National Cabinet on a number of occasions, and the federal government is confident that we have sufficient supply. But there are still lots of people in New South Wales that haven't even had one dose of anything. So we really need to focus on that. We really need to focus on people coming forward for the first time and getting vaccinated. It's really important that if you haven't had the vaccine yet, please come forward and do so. It's really important for the greater good, for reducing the spread, and also to keeping your loved ones safe.
Mr. Berejiklian.
We're still getting a lot of calls from people who have got their vaccines but cannot get their vaccine passport. It's not uploading. There's some kind of bureaucratic issue in the system. What do they do? Monday they can go to picnics, but they can't prove it.
Yeah, well, obviously the process for acquiring your vaccination passport through the Medicare app, I'm told is reliable and has been providing people that information. I don't know otherwise, but suffice to say, as I've said, in addition to the federal government information you can get to prove your vaccination, New South Wales will be using the data that the federal government will be making available to us to develop our own passport, so that when you use your New South Wales or your Service New South Wales app to check in anywhere, you automatically will get your vaccine credentials there, so you won't have to do anything extra. We're hoping that'll come into effect, obviously in early to mid before we open up at 70% double dose, definitely in early October. But in the meantime, you can download that information as much as I understand, and we'll follow up on that.